Good morning. I'm LaShondra Shaw, PIO for the City of Austin, and I am the moderator for today's news conference. Spanish interpretation of this media availability is on ATXN 3. To start, Dr. Mark Escott, Interim Austin Travis County Health Authority, will first say a few words, followed by Stephanie Hayden, Austin Public Health Director, then Andy Brown, Travis County Judge, followed by Steve Adler, Austin Mayor. We will then open it up to the pool reporter who will ask questions on behalf of the media. Dr. Escott.
Thank you and good morning. I'm going to share my screen to show some slides to illustrate the discussion points this morning. Unfortunately, our community has reached another critical moment in our fight against COVID-19. Over the past several weeks since December 1st, we've seen a 97% increase in our new cases diagnosed in Travis County. In addition to that, we've had an 80% increase in our moving average of admissions to the hospital. And in fact, yesterday alone, we had 70 new cases admitted to the hospital. We've also seen a 50% increase in the overall number of hospital beds being utilized for COVID-19 patients in our community. And in addition to that, our positivity rate is almost 10% last week, which is more than triple our goal of 3% positivity in our community. Because of this, and because of the concern facing us with Christmas and New Year's, and the concern that we may see an impact similar to what we saw during Thanksgiving, that's combined with the threats going on around the state of Texas. We see surges right now happening in Dallas, in Fort Worth, San Antonio, and Houston. And unfortunately, it creates a situation that leaves significant concerns about the availability of additional staffing and resources should Austin surge as well. Due to this ongoing worsening condition and the uncontrolled widespread community transmission of COVID-19, we are going to be elevating our community risk level to stage 5, which is our highest level of risk for a community. So what does that mean for us in the community? It's not just protocols, it's not just instructions for businesses and restaurants. It gives us an idea of the risk as individuals that we may face when we are outside of our household. And it's important to understand that risk is significant. In this stage 5, it means that there is so much community transmission going on that literally anywhere we go outside of our household, we have to consider ourselves at risk. And quite frankly, we're not seeing transmission amongst strangers. We're seeing transmission amongst people who know one another, members of extended families, friends. Those are happening because those are the individuals that we're willing to take our mask off in front of. So for stage 5, we're recommending that everybody, regardless of their risk level, avoid non-household gatherings. We're advising them to avoid dining and shopping and to transition to takeaway and delivery as much as possible. It's important to avoid non-essential travel for gatherings or for other things outside if you don't have to. And again, we're recommending businesses transition to that curbside or delivery model as the primary method of their business. All along, we've tried to balance the economic health and the public health. And unfortunately, what we're experiencing right now is significant imbalance. We're seeing a significant increase and a rapid increase in that risk to public health. Some people will ask, why are we sounding the alarm right now? Why not wait until the hospitals are full? And to them, I ask this question. When you see smoke, do you pull the alarm? Do you call the fire department? Or do you wait for the flames to roll down the hallway? What we've learned over and over again in other communities in Texas, across the country, and across the world, if you wait to pull the alarm until the hospitals are already full, that surge will continue until the hospitals and the morgues are overwhelmed. And we simply cannot afford that in Austin and Travis County. It's important to remember that the time to act is now. It's not in 2 weeks, it's not in 4 weeks, it's today. And we're calling on people to be heroes, to save lives this Christmas season. And it's critical to understand that it takes all of us working together, all of us making the simple decision to stay home when we can. And if we have to go out, to wear a mask, to distance, and to ensure that we're washing our hands and not touching our faces. Together we can get through this, but it is going to take all of us. And with that, I'll pass the microphone to APH Director Stephanie Hayden.
Good morning. With Christmas and New Year's holidays quickly approaching, we are here to sound the alarm. We must move quickly to let you know that we all have to determine what is my individual responsibility. We know that with Thanksgiving, there were so many gatherings, and we are seeing the results of that. We are trying to put us on a path where we can flatten the curve. It is going to be important for us to think about what's essential. We have lost 525 people this year to death. Please think about your loved ones. Think about those people that you hold so dear to your heart. Whether it's your parents, your grandparents, your children, your nieces, even your pets. We have people that love their dogs and love their cats. Do everything you can to be around, to care for them in the future. Our eyes should be on future celebrations. I am not asking you to cancel the holiday season, but what I am urging you to do is establish new traditions. We know that there's been some very creative ways to be virtual. I am old school. Pick up the telephone, call people, have those conversations. All of those things are safe. We want you to celebrate with the people that live in your household. We don't want you to gather. We want you to remain with the people in your household. You can decorate. You can, I was talking to a lady and she told me she put up 3 trees. And I thought, oh, that's, really exciting, because she wanted to just have just a little bit more celebration in her home. And it's just her and her husband. And so they decided to put up additional trees. You can watch some of those films that they show, those movies. My son is an adult, but I still love looking at Frosty the Snowman. And so just think about what those things can be just to keep us safe. Austin, I applaud you. I know there have been so many people that have celebrated milestones, and you've made that sacrifice. And I cannot tell you how much I appreciate that sacrifice that you've made. It has really helped us to be where we are today, your individual sacrifices. When I think about the Christmas celebration coming up, the greatest gift that we could give is health. We want to make sure that we're doing everything we can do to keep our community healthy. Let's think about how we can celebrate in years to come. We need to stay home this year. And I also would like to close by saying, this is the time, Austin, Travis County, this is the time. We are sounding the alarm. I am my brother and my sister's keeper. At this time, I will transition over to Judge Brown.
Thank you, Stephanie. At every stage of this pandemic, our health authority, our health professionals, and science has been our guide here in Travis County. My kids are 4 and 5 years old, and they ask me when this is going to be over. And I know that it is a rough time for everyone, but if you follow the advice that we're giving today, we are going to get through this together. I know it. Every time we've asked for this community, these community sacrifices, our community has risen to the call. We've stayed home, we've helped provide necessities for our neighbors, and we have closed or limited businesses to stop the spread of COVID. I've seen the tremendous impact this community can have when we're all pulling in the same direction. And by following the recommendations of Dr. Escott and our health professionals, we were able to flatten the curve when we faced a surge following Memorial Day. I'm confident that together as a community, we can do it again now. We're entering a dangerous time, stage 5. And if our community does its part and follows the stage 5 recommendations being presented today, we can stop the spread of COVID-19 and the necessity for more restrictive measures. Our stage 5 order urges these recommendations. We are asking businesses and restaurants to limit occupancy and encourage pickup or delivery services. This includes closing indoor dining spaces and limiting outdoor dining to 50% capacity, limiting indoor retail occupancy to 50% capacity, and ending all dine-in and retail services between 10:30 p.m. and 5 a.m. Changes like these can do a lot to slow the spread of COVID. If we cannot successfully slow this surge, we're going to need to consider all options to keep our community safe. And that could include requiring actions instead of urging them. To actively prevent more significant measures, both county and city departments participating in enforcement are going to continue with increased inspections and enforcement. We're going to hold bad actors accountable and issue citations when deemed necessary. We all want the same thing, though. We all want a healthy and happy holiday. And we can accomplish that by working together and following these recommendations that Dr. Escott is giving us today. There's still a lot of fun and festive COVID-safe activities that can be done this holiday season from home. And I really like the one Stephanie just mentioned about using the telephone and calling people. We can also have virtual holiday concerts, video calling family members that don't live with you. There are lots of creative ways that we can get through this together and do it from home with the people we live with. Now for Telemundo. En cada etapa de esta pandemia, nuestra autoridad sanitaria, nuestros profesionales sanitarios y la ciencia han sido nuestra guía. Nuestra comunidad respondió a la llamada, nos hemos quedado en casa, ayudamos a satisfacer las necesidades de nuestros vecinos y cerramos o limitamos negocios para detener la propagación. He visto el tremendo impacto que esta comunidad puede tener cuando todos tiramos en la misma dirección. Estamos entrando en un momento peligroso, etapa 5. Si nuestra comunidad hace su parte y sigue las recomendaciones de la etapa 5 que se presentan hoy, podemos detener la propagación del COVID-19 y la necesidad de medidas más restrictivas. Es hora de dar un paso al frente, Condado de Travis, para que podamos evitar implementar medidas más estrictas y podamos tener unas vacaciones saludables y felices. Gracias. Thank you very much. And with that, I'll pass it on to Mayor Adler. I think you're muted, Mayor.
Thank you, Judge Brown. You mentioned Director Hayden's suggestion for the phone is your favorite. I was actually taken by the suggestion that we all watch Frosted Snowman again. I hadn't really thought about that. Now I'm real eager to make sure that happens in my home. I think collectively what we're all saying here is that we need the community to act and we need the community to act together. It is by our actions, our collective actions, all of us, that we get to decide the impact that this virus is going to have in our community now that we are reaching crunch time. Our future is dependent on our actions. We want to remind everybody, follow the 3 W's: wash your hands, watch your distance, wear your mask. We keep repeating those things because those are the things that really work. They're easy to do. They may be inconvenient. We may not think we look cute with a mask. These are easy things to do for the benefit that we get. You should cover your coughs and sneezes, clean frequently, touch surfaces, and absolutely, absolutely stay home if you're not feeling well. If you need or would like COVID-19 testing, it is available throughout the community, and Austin Public Health offers free testing. And you can enroll at, excuse me, you can enroll at austintexas.gov/COVID-19. austintexas.gov/COVID-19 for free testing. As a community, we are so close to the vaccine. In fact, it has already arrived and started to be handed out in our community in the most strategic way. We need to work together. This may be our last hard time now that the vaccine is coming and beginning to be distributed. We need people to hold on just a little bit longer. You know, with the first of the vaccines already here, we're focusing on vaccinating frontline healthcare workers, long-term facility staff and residents at places like nursing homes. More vaccines are going to start coming and be more and more available to more people in our community, beginning with those that will suffer the most severe consequences if they get the virus, or people that are least able to protect themselves and have conditions that make them most vulnerable. But until we get this vaccine to everyone, people need to continue to take the COVID-19 prevention measures. It is not time to throw the masks away just yet. In fact, with the numbers that are rising, with the holidays that are approaching, it is more important than ever right now that everyone wears a mask when you are around anyone that you don't live with. You know, throughout this pandemic, Austin-Travis County has kept our COVID-19 numbers, especially deaths, comparatively low. It hasn't happened by accident or by luck, but through real community action. That's why today we are asking and encouraging, requesting, recommending that people change behaviors. There are also some businesses that are going to get hit harder than others because of this requests, restaurants and bars and some retail. So part of the community action that we're calling for, if you can, is let the restaurants cook your food. Do delivery, do takeout, maybe a little bit more than you have been. Buy some gift cards. Make sure to tip your wait staff well. In fact, over tip. Let's take care of these businesses also that are going to be most hit because of the recommendations that we're making today. By our actions together, we get to decide our future. We have control. Let's use our power, our collective power, to keep everyone safe. We get to decide the direction our community is going to be taking over the next 4 weeks. With that, I think I'll turn that over to the questions from the media.
Thank you, Mayor. At this time, we will have our pool reporter ask questions on behalf of the media. Casey?
The first question comes from Fox 7. Was there any reluctance or concern to move into stage 5 near the holidays? And after the stage 5 risk, what would be the next step if numbers and cases continue to spike?
So I'll start off by answering that. There certainly wasn't reluctance because of the holidays. The data is the data, the facts are the facts. We initially hit the 50 range Thursday of last week. Over the weekend, we saw it drop to 48. And then again on Monday, we saw it back up to 50. The concern that we have at this stage is because there's not an indication that we're flattening. The positivity rate is going up, which is predicting that we're going to have more cases this week than we did last week, more hospitalizations this week than we did last week. I'm expecting today we're going to see at least 70 admissions, perhaps closer to 80 admissions. So what we're expecting is a rapid increase in cases, similar to what we saw near the peak of the summer surge. That's the thing about COVID-19, about infectious disease, is it accelerates with the kind of activity that we're seeing. In particular, we're concerned about the 1-2 punch of Christmas and New Year's that may accelerate it even faster than we saw during Thanksgiving. And that puts us in a very dangerous situation very quickly after New Year's.
The next question is from KXAN. How will the city ensure that people take these latest orders seriously and the new restrictions binding law? Will any of these be enforced? Will the police department help?
During this time, the city of Austin and Travis County individuals that do enforcement have been providing more so warnings, technical assistance. Recently, we have moved to an enforcement perspective. So what's going to continue to happen now is citations will be issued. And so with those citations being issued, they are progressive in nature. And so we are going to continue to provide those citations to keep our community safe.
The next question comes from Univision. Will a curfew be implemented, and what will the consequences be if they aren't followed? We've been seeing bars operating as restaurants. Are you considering any restrictions or tighter enforcement?
Well, I'll start by saying that we are very concerned about the bars operating as restaurants. They may have a food service permit, but they are still functionally a bar. And why are we focused on bars? The concern with bars in particular is that the drinking happens continuously, that there's face-to-face interaction, and that face-to-face interaction happens over an extended period of time with multiple different people. So we're asking our bars to follow the rules, to make sure that people are seated if they're being served, and to ensure that there's appropriate spacing between tables, to ensure that they're managing the queues inside and outside of those facilities. If people are following the rules, if these facilities are following the rules, then we can decrease transmission without having to resort to a curfew. But if we can't, we have to take all necessary steps to ensure that we do not have a catastrophic surge like has been experienced in El Paso and in Lubbock.
I'll also respond. Sí, hay una posibilidad de un toque de queda, pero como dijo el doctor Scott, no queremos llegar ahí, y si la gente sigue las sugerencias que estamos dando hoy, es probable que no lleguemos ahí. Pero si no, y si los casos de COVID-19 siguen aumentando, es posible que sí vamos a tener un toque de queda. Y otra cosa es que sí, me da mucha preocupación que los bares hay varios bares que no están siguiendo las reglas. Y ahora, como dice Stephanie Hayden, vamos a tener multas para los bares que no están siguiendo las reglas.
I think in this regard, too, it's also important to note that it's not the places, it's the behavior. The reason why restaurants or bars present increased risk is because in those situations, you're not wearing a mask all the time and you're face-to-face for extended periods of time. And that's why the focus is there. That's why the enforcement issue is to make sure we do those as best we possibly can. Curfew is something that's being considered, but only if it's something that has to happen to keep the community safe.
The next question is from Community Impact. What does this mean for schools? Will you make the recommendation to immediately cancel all extracurriculars? And will you recommend a period of all virtual learning after the holiday break?
So we have recommended to our superintendents that extracurricular activities where masking and distancing cannot be followed, those be suspended or significantly limited to decrease the risk as much as possible. I know there are football playoffs going on right now. I know those are very difficult situations. But what we're asking schools and the entire community is decrease the risk as much as possible, as quickly as possible, so that we can decrease the transmission here and flatten the curve. Regarding after the Christmas break for our schools, we're going to continue to monitor the data as it comes in. If we continue in a significant and aggressive upward fashion in cases and hospitalizations, then it's likely we would make the recommendation that schools go virtual. That may not be a uniform request across all schools. We will try to preserve our elementary in-person education as much as we can, because we know that the data suggests that those are the students who most benefit from in-person and who are most impacted by having to transition to virtual. So we'll continue to communicate with those superintendents over the holidays and continue to advise them on what the public health data is suggesting.
The next question is from the Austin American-Statesman. What kind of citations are being issued? Is there a fee, a charge? What is the fee and the charge?
We'd have to get with our enforcement departments regarding the details on the fines. Again, I'll say that we will do whatever we need to do within the law to protect this community. So if the fines aren't working and we have cause for revocation of things like food service permits, we will take the necessary steps to protect the community.
And Dr. Escott, just to repeat again what we've been saying all along, ultimately we can't enforce our way to compliance. This has got to be something that the community wants to do by its collective action. Ultimately, we're going to do everything we can to enforce, but ultimately, this is really up to us as a community.
The next question is from KView. Associated Press is reporting that Texas is desperate for doctors and nurses. Are we seeing a shortage here in Austin, and is it impacting our number of staffed hospital beds?
So our hospital systems in Austin today are stable. We have enough staffing, we have enough beds. The concern is, what if we need more? What if we need more doctors, nurses, allied health professionals, paramedics? Are they going to be there? And the answer is, I'm not sure that they are. I can tell you that I've received emails and phone calls every single day, because I'm an emergency physician, from recruiters offering lots of money to go work in West Texas, to go work in North Texas, in Dallas, in other states. The same is true for nurses. The same is true for our respiratory techs and other folks we need. That indicates to me that there's not enough resources, and that there is going to be a crunch time, and it's rapidly approaching where we are not going to be able to secure additional resources. Again, right now it looks like we're going to be fourth in line to surge, behind Dallas, Fort Worth area, San Antonio, and Houston. And we expect that those resources, the state resources, are going to be deployed to those places that are facing more serious surge earlier. I am very concerned that it may be challenging for us to get those folks in when we need them.
And I'll just add to that. That's exactly why we're asking people to make these sacrifices. There's a limit of about 200 people in the ICUs. I think we're close to halfway there at this point, and that's exactly why we're doing this today, is because we don't want to get into that situation where we have to question, whether we have capacity to serve additional people in our ICUs. And that's exactly why we're doing this today.
The next question is from Fox 7. You all are encouraging residents and community members to stay at home and to not gather with those outside your household for the holidays. With that, what are each of your plans for the holidays, and do you plan on following that?
Well, I can start. I'm having Christmas dinner with my wife and son and daughter. We're going to Christmas midnight mass from our couch in the living room. That's the extent of the plans. I think that, if we can get more folks to make the sacrifice and to avoid the large gatherings, if your church has virtual services, please use those virtual services. But it's also critical to understand that our churches, our nonprofit agencies, our community groups also depend on our support, particularly during this time of year. So if you're going to do virtual services, make sure that you give. Make sure that you give more than you might normally if you're sitting in the pews at church, because we have more people in need now than ever, and they are depending on us.
Well, me and my husband and my son will be here in Austin. And that's what we did for the Thanksgiving holidays. It's going to be important for us, as we talked about earlier, making those individual decisions. One of the things I was really excited to do on Thanksgiving Day was I was able to do a Zoom call with 5 of my very close friends. A couple of live here in Texas, one lives in Philadelphia, and one lives in California. So we all got together to have that Zoom call, because to be honest with you, we typically get together for Thanksgiving. It's the time of the year that we are able to get together. And we've been friends since elementary school. So that was a real big change for us, because we are Black Friday shoppers, and we tend to get together and hang out and catch up and laugh and have a good time. But we know it's really important, because we're living in so many different places. The infection rate is different in all of the states that each of them live. So it's important for us. And they are definitely, listening to me with the advice that I provide them. And so it is so important for us to make sure that we are doing what we're asking you to do. So my hope is that you are a hero. You are a North Star that folks can say, well, you know what? My best friend is doing this. I need to do the same. And I agree with Dr. Escott. There are virtual services, and I typically do the virtual services. And, you must continue to give, because there's so much need. And I totally agree with that, by doing your part to provide, any funds that you have, if you are fortunate enough to do that.
And like the others, I will be with my immediate family, the ones I live with, over the holidays as well, but hoping to be virtually with many other people.
And I guess I'll throw in my 2 cents. So yeah, I'm gonna stay home with my wife and our 2 kids, our 4 and 5-year-old kids. And my dad actually has pretty advanced stages of a disease similar to Parkinson's. And so I understand how important it is, how much I would love to sit down and have a meal with him and my mom, but we're not going to do it other than virtually or through a window. But because any exposure to him from any of us without a mask on can be detrimental to his health. So I understand that. I also want to just touch on the good conversations we've had with faith leaders. And I think the mayor and I both reached out to the Muslim community, to the Austin Diocese, to some of the ministers and pastors in our community. And I was very impressed and heartened to hear of all the measures that they have already planned on taking, how they're making services available virtually. And for those that up until this point, I guess, who were unable to do that, they were taking precautions to make sure everybody wore a mask. There was distancing between people who did not live in the same house as one another. And I was encouraged by their help and activeness in this so far. And I'm certain that they're going to take this movement into stage 5 seriously and do everything that they can to help prevent the spread of COVID.
The next question comes from KXAN. What effort, if any, over the next few days will be made to crack down on bars and restaurants masquerading as bars where a lot of the spread is happening?
So we are continuing the enforcement actions and continuing the inspections. That happens through our environmental health services at Austin Public Health, through the code department, through the city and county fire marshal's offices. We are asking our entire law enforcement community to be on the lookout, to enforce the masking requirements under the state law, under the executive orders. Those things actually work. The masking and distancing works. We do not see transmission between two people wearing masks. It's just not happening. So we are needing to increase the seriousness of that, but as Mayor Adler said, we can't enforce our way out of it. We need people to make the simple decision to wear a mask and to really be a hero this holiday season. It's simply that easy. Please wear a mask. It's a minimum intrusion on every one of us, but the impact collectively can be massive.
The next question is from Community Impact. Do you have a threshold in place that would cause you to recommend a curfew if you do not see a downward trend? When would you expect to make that recommendation?
So we'll continue to monitor the new admissions to the hospital. We'll continue to monitor the new cases, the positivity, the ICU and hospital bed status, and then we'll make a determination. I'll say that we need to see some changes relatively quickly. We do have a significant concern about New Year's and the gatherings that normally happen during that time period. So that decision could come quickly. But again, our hope is that people have already been adjusting their risk behavior during stage 4, and with stage 5, we'll make even more significant adjustments so that we can decrease that risk quickly and avoid having to take steps like a curfew.
Mayor, you're muted.
Sorry, just quick to point out on the question of curfew, obviously will be directed by Dr. Escott and Director Hayden. When we talk about curfew, the kinds of things that are being discussed at this point, if it's necessary, is a curfew that starts about 10:30 at night and continues over the night to make sure that people go home and that people are not out at the bars masquerading as restaurants and the like. But I think that does point to, as we're all thinking about New Year's Eve approaching, this is the year when we'll all be watching the new year come with our families at home.
The next question is from the Austin American Statesman. Judge Brown said dining and retail will have to be closed from 10:30 p.m. to 5:30 a.m. under stage 5. Is this considered a curfew, and will citations be issued to places who stay open during these times? What kind of citations?
So to clarify, the order or the discussion that we're having about stage 5 today is recommendations. And I think that along with Dr. Escott and the mayor, we are hoping that we do not get to the point where we have to mandate additional measures. But today, what we are asking is for the community to take those steps, those additional steps in stage 5 on a voluntary basis.
The next question is from Curfew. Are we close to needing a field hospital back at the convention center?
Our concern is that could be weeks away, like 3 or 4 weeks away. So the discussions, the readiness is starting to increase as we look at projections which may exceed capacity. Again, we are expecting the UT Modeling Consortium to update their model today. It hasn't been updated in a couple of days, and I'm quite certain it's going to be more pessimistic in terms of the outlook. We have also asked them to model what we can expect to see after Christmas and New Year's based upon the surge that we saw after Thanksgiving. So there may be some additional models that come out in the next several days to give us a better indication of the magnitude of surge that we may be experiencing over the next 3 weeks.
And this will be the last question. It is from Univision. What will you be doing about concerts already approved to take place, like in Jarapos in the county? There are a few announced to take place on New Year's Eve.
What we feel like is going to be very important is we will definitely be proactive to work with the vendor, make sure that they are taking all the necessary precautions. But it's also going to be important for individuals to call 311 if they have any concerns. I would be remiss to say my hope is because we are telling you this today that you will stay at home, that your New Year's Eve celebration, move the couch back, move the table back, crank the music up, and have a celebration at home. You can do it virtually. Just think about new traditions. We've got to get out of the mindset of saying, I've got to live for right now at this time. My hope is that a year from now, if you choose and things are better and you decide you want to go to that club, I typically don't club, but I might be so excited I might go with you next year. So my hope is just think about right now and do everything you can do and just don't go to those celebrations. That is my hope.
Thank you for that, Stephanie. At this time, that concludes our news conference. I would like to say thank you to APH Director Stephanie Hayden, Dr. Mark Escott, Travis County Judge Andy Brown, and Austin Mayor Steve Adler, and to our pool reporter Casey Bowen from Fox 7. Thank you all for joining us today, and have a safe week.
Thank you.